I have another question for you. How many people are a little nervous about thinking about getting a colonic? Yeah, all right. And that's a really important thing for everybody to register. People feel a little uncomfortable about it. And the things I'm going to share with you today are not the usual things that you would do for stress or the usual things that you might expect to hear about getting the colonic. I'm going to tell you the magical story of colon today and how it relates to all the other parts of your body and how there are many, many keys to this kingdom, and that your locus of control can start to shift to inside of you instead of outside of you. We're figuring it out and setting it straight, okay? So I'm going to keep, every time I get to a new little topic, I'm just going to start handing these things around and you can share them. There's not enough.
And I have spare paper here if anyone wants to take notes.
Oops, I gave you two.
There's an extra here too.
Okay, she just asked a really good question. She said, what's a colonic?
Is it a colonoscopy?
No, it's not a colonoscopy. You could use it for a prep for a colonoscopy. It's a really,
I've had it.
it's a really fancy.
And it's so successful.
It's an extra one.
Thanks, whoever's got an extra
Is any-
share around.
Yes, yes.
Getting a
That's
colonic.
why she's here, to educate you guys to understand this is going to help you immediately.
So, colonic is just sort of the short word for colon therapy or colonic irrigation. And if you remember watching the old MASH series with Al and Alda, they were always joking about giving Frank high colonics, you know. And back in the 50s and 40s, it was in the province of nursing to do that, you know. Start with hot tap water enemas, hot and a hell of a lot, they used to say. And then move on to a more full irrigation. Because it so reduces the toxic load and relieves stress in the whole GI system that it was kind of a no-brainer when there was other limited access to other drugs and methods. Okay? So it used to be a method of choice. It was in the province of nursing, and then it went to chiropractic more towards the 50s, 60s, 70s, and when chiropractic made the deal with the insurance companies to get coverage, medical payments for doing chiropractic care, that was on the condition made by the insurance companies that they would drop colonics. Colonics wouldn't be covered by that service. So most chiropractors, although they're trained to do it in school, and a lot of naturopathic schools also train in colonics, like Bastyr University has trained in open and closed systems in colonics. So by the time you become a naturopath, you know how to do this for your patients. So now that it's not covered by any insurance, it's sort of gone, you know, no one really hears about it unless they really seek it out and need it. Okay. I'm gonna, the one I just gave you about the unresolved feelings in their target organs is to start to talk about how the colon is really the seat of not just the emotional body, but also, here it is, the colon, the big loop around the outside of the bowel is the large colon, and that's where I'm working here. I can't get into the small colon through the large colon. There's a little vent, a little valve over here, the ileocecal valve, that shuts when water's coming towards it. And the way that the colon works is that it drinks water. It's one of its biggest jobs. It's like the biggest job it does, aside from moving along the compost heap. And in fact, during a colonic irrigation, your colon will drink 2 to 3 cups of water at a time. The whole session is limited by it getting waterlogged. So it's a self-limiting process. You can't water intoxicate ligaments. And that's really important to know. It's just water, pure filtered, 15 to 20 gallons of water that doesn't have any fluoride or chlorine or chemicals or metals or anything. It goes through a lot of filters and it's ozonated. So it's basically sterile drinking water. And that's what a colonic irrigation is. So why do I think this is going to help anybody? You know, what if I'm already having a bowel movement every day? Well, what I'm interested in doing is helping people activate their secondary pathways of elimination. Okay, so if you think of the organs of elimination, lungs, liver, kidneys, colon, bladder, and of course the big one, skin. The biggest one is skin. And what I notice over many, many years of this kind of work is you can learn a lot from people's skin. Because when the liver gets backed up, and the liver gets backed up when the colon gets backed up, the secondary pathway, the next pathway it tries to activate is through the skin. So people who have like very dull or listless or pimply or chronic issues in their skin, you know, most of us when we're not feeling well, you could say that's a colon issue. I wanted to also, let's see if I have, this is the other end. It's only the other end of the alimentary canal. And after all, we all are brushing our teeth once or twice a day and flossing very often. And the other end of the tube, it's the other end of the same tube. It gets no attention, it gets no respect. It's basically the Rodney Dangerfield of the whole system. And I'm here to plead its case. So, let me begin by just making some of these connections for you. In your colon, there are, you don't have to open up the back until later if you don't want to. I want to show you the healthy colon first, okay? Because the other side's too scary. Yeah. Did I just step on the baby
Yeah, just
girl?
step on my dog.
Sorry.
You have to leave now.
Okay.
She's under your table. Is that okay?
That's fine.
Okay.
What I want to show you here is that all these, you can see all the places in here that have autonomic reflex arcs, that is, that are connected to organs, tissues, and systems in your body. And it sends the messages and receives messages from them. Whoops. And so it governs a lot of autonomic or automatic functions. Okay, so just to back up a little bit, there are two major parts of your nervous system. The central nervous system, that's the one that's up here, you know, the big thinker, the one that reads, the one that plans, the one that says, you know, I got to get to work on time, and does all that stuff. And then there's the autonomic nervous system, which is, it should be automatic. In other words, you shouldn't have to think about the functions of it. They should just happen, like programmed into your iPhone. Things that you don't have to think about, they just happen. So breath, digestion, elimination, kidney function, your heart rate, all kinds of things are governed from the autonomic nervous system. And since they all have reflex arcs in the colon, this is called the second brain. So this autonomic nervous system also has two parts, sympathetic, parasympathetic. So sympathetic is like, oh, I'm gonna be late, and you get a big dump of adrenaline and off you go, charging. That's your stress, that's a stressor. Okay, and then the parasympathetic is the calm down, completely different hormones. The hormones associated with digestion, with rest, with feeling fabulous, just like being in your body. It's serotonin. Okay, that's your feel-good hormone. And you get a big dump of that when you do a colonic, when you do castor oil packs, when you do massage. I'll show you a lot of ways you can get that dump of serotonin. But the point is, when you are relaxed, the whole system gets it, not just the colon. You feel your neck relax, you have when I got my first colonic, I didn't have to wear my reading glasses for an hour afterwards. That blew my mind. Really, I was filled up to here. Honestly. So, what I want you to do is picture this beautiful thing, sort of stretched out so it stands up straight and tall. Okay. Over here is the appendix, this little loop hanging off here at the bottom. And if we just sort of unwrapped it and made it stand up straight, you would have all the reflex arcs that are on you from your head to your toes. And so there is inside your colon, this basically your inner child. And it's not only receiving and sending messages to all your major organs and systems and tissues, but it's registering your stress level, your especially fears, surprise, alerts, you know, things that can help you with survival. And it also registers when you're really relaxed, when you're really happy. And those things have the effect also of reducing your heart rate, reducing your blood pressure, improving your digestion, all those kinds of things. So really good to know. And I'd also just like to say that even though all of these horrifying pictures on the back are really from real x-rays, I've taken care of plenty of people who have a messed up bowel who do really, really well with irrigations. Go ahead.
So you were mentioning the autonomic system, and a lot of us have problems with our autonomic system. So
Yeah.
does that mean that we're especially problematic with our colon?
Yeah, and I think,
Or would that
I
not
don't know
matter?
enough about ED, but I think,
S, add the S, otherwise you
EDS.
talk about something completely different.
Yes, women can have ED.
EDS. Have issues with connective tissue, chronic inflammation problems, degeneration, or just not maximal function, then colon's front and center, because it's nothing but layers of muscle, different kinds of muscle. Some that squeeze all at once and some that sort of squeeze along. And if you're losing muscle strength, or if you have chronic issues anyway with not being able to move very much, or you know, there's like 1,000 things that could feed into why you don't eliminate enough. So what is enough? Could people please be having a bowel movement a day? At least, I mean, it's supposed to be, you know, it's supposed to be about like 10 to 12 inches of stool that you're eliminating per day. It usually eliminates from up here and goes down through the descending colon and out, and that's why sometimes after a really good bowel movement, you'll notice that it looks like a banana or an S shape. Okay, you cleared that descending colon, awesome. And I don't care whether you go once, twice, 3 times in a day. I'm worried about the amount and what it looks like. Is it this big around? Because if it's not, guess what? Your colon is spazzing out somewhere, or stuff is getting stuck on the side or in pockets. When I say pockets, I know it looks like a bunch of pockets, but go ahead.
I have the issue because of my dysautonomia and the EDS. I don't go to the bathroom. Sometimes I've been locked out for like 2 weeks.
I can help you with that.
And everybody's like, oh my god. And I take stools off mirrors. I do Miralax. And it's just like, all right, when's it coming out?
Yes. So whatever you're taking, I'm glad that you're going and not going.
Yeah.
But bowel training is still possible, and it's a wonderful thing. And the reason I don't see many people in chairs post-injury from war or accidents or any kind of severed spinal cord is because they bowel train them before they leave rehab. And I'll explain how they do that. Why don't I explain it right now? What they do is it's all timing. It's very Pavlovian. So they'll take someone and first thing in the morning, same time every day, 6 a.m., 7 a.m., 8 a.m., it's going to be before 10 a.m. because on the Chinese clock, this is the Chinese medicine, bowel time is 6 to 10 in the morning. And it's sort of like the easiest time of day to go for your system. And very often, if you don't go during that time, this is like Sleeping Beauty. She goes back to sleep until the next day. It's one of the reasons I use enemas before colonics. I want to clear that lower bowel, and I want to make sure Sleeping Beauty's wide awake when we go to work, because I want to get all the way over the appendix. I don't want to mess around with descending colon. I mean, it looks like a big show going by in the tube. You get to see everything, the whole parade of stars. But that's really what you should have eliminated before we started. And then we get to the backlog, and that is an amazing thing. People are amazed, you know, and I'm going for the 10-gallon avalanche. And if I don't get that, I want you back like the next day or the day after. Because colonics are funny. They're not just, it's not like you get one and you're done, you know. Like, get a mammogram every year and that's what you do for breast health, I hear sometimes from physicians. I wouldn't tell anyone to get one colonic a year and be done with it.
How often do you?
It's really individual for everyone. For someone who's eliminating every 2 weeks, they're going to probably need 3 to 6 to start, just quick, 1, 2, 3, and then start spreading them out. 4, 5, 2 weeks later, 6, 3 weeks later. And they're doing a lot of homework in between. I've taught them to use an enema. They get it as a party favor to take home. I mean, an enema bag, not a fleet, a big bag that's like see-through and takes 1.5 liters of drinking water. And you know, I teach that as a skill so that people can manage in between without taking maybe Miralax or whatever.
And that doesn't cause dependency, like if you use it?
Very good question. It depends because it's all in the bowel training. The colon is the smartest, most forgiving organ in the whole body.
Right.
It learns and integrates and follows every command it gets, every signal you send it. So if you started doing enemas every day to clear your bowel, it would go, oh, okay, she doesn't want me to go, she's going to do it for me.
Right.
And then you would be enema dependent. But that's just a question of training. If you timed your enema after your bowel movement, no matter how big or little, you'd be horrified in wonderment and amazement at what comes out. Okay? Because even when you clear, if you have a great bowel movement and clear this whole descending colon, you still, you put in a bag of water after that and you're going to clear the whole transverse. And that is an amazing feeling because then you've got nothing in there but drinking water and clear space. The colon hydrates the rest of the body. What happens is once it gets some water, it hangs on to a bit of it. Some of it stays in the little pockets. It takes about an hour for it to pull all that back into the system. Through the portal vein into the liver, through the mesenteric arteries into the spleen and pancreas. All the internal organs of digestion get this fresh glass of water for the first time ever. Then they just go. You know, it's like Scrooge on Christmas morning just going, oh my God, I've got another chance. It's a great feeling. It's indescribable. It really is. You just have to experience it. So much for enema dependency. Your colon's really smart. So, I know, I was talking about bowel training. So this is how they do it. They put the guys or women, whoever's got the spinal cord injury, onto the toilet at the same time every morning. And they've got their feet up on a little stool or something to make it more ergonomic, because toilets are not ergonomic. If you don't have a little step stool under your feet when you sit down on that thing, yeah, just get your feet up, you know? It's going to shorten the length of the rectum by like 2 inches. It's the same principle as squatting to give birth. You know, it's less chance of popping a hemorrhoid if you get your feet up when you want to eliminate, okay? So, on the toilet, feet up, timer on, just a little egg timer, 5 minutes, and an enema bag full of beautiful water just hanging there in front of their face. They don't get to go on their, they don't get to go on their cell phone, they don't get to read, they don't get to have the radio on, they just sit there with the timer on the toilet with the enema in front of them. And if they don't go within the 5 minutes, ding, okay, onto your left side for an enema. Okay? Now, it takes about 21 days, sometimes less, but to be generous, say 3 weeks. it takes that long to make a new pathway into your nervous system for it to learn. For the colon to learn this, for your whole system to really get it, it might take up to 3 weeks every day. And it has to be every day, it has to be at the same time, it has to be 5 minutes, it has to be consistent. Because whenever your body gets one consistent, strong signal, it always does what it's told. The problem with us is that we're not really consistent, you know, so there are plenty of people who really want to have a perfectly good diet, but you know, you have bad days, you have dry days, you have all kinds of stuff. And so it's really hard to stay on the straight and narrow. It's actually sometimes easier for people who are being battle trained in a chair. What choice do they have? They can't get up. If ever someone's going to put them on this toilet, their body gets it. So I very rarely see them, unless they have some other strange thing going on. Okay. I wanted to show you some other stuff too, that just will connect in your head the whole tube that goes through your body, because it really isn't all that different from each other. And everything sort of is affected by what's going on everywhere else. This beautiful picture of all these different tongues was that artwork that was done by a student at RIEDS for an acupuncturist friend of mine. As just a quick reference thing, how if you've ever had acupuncture, they often look at your tongue, they take your pulses, and then they go to work. And sometimes no matter what you say, it's my liver, and they're like, no, it's your kidneys. Or they do what your pulse says and what your tongue suggests. It gets taken into account, not just your subjective feeling about it. So I love that drawing, and it's really helped me a lot. Just, you know, when I'm feeling bad, I start checking. Is this on the chart? Is this on the chart? I have a weak heart, and so I have the tongue with a little split down the front. And so I know that that's real, and so why not anything else? If you've ever been sick, your tongue has like a fur coat on it. It's almost white, yeah? Or if you're a heavy dairy lady, or you know, if you decide to fast for a week and detox, your tongue would look like fur, you know? So it really is, it's kind of an interesting thing. So I want to give you, on the back side of one of this, you see your hands. So I was talking about reflexology before in the colon, and how when I do colon therapy, I've got people under a warm heating pad. I've got castor oil on their belly. I'm using castor oil packs. I'll explain those in a minute. The heat is to drive the castor oil in. Used topically, it's a very gentle, wonderful decongesting remedy for a lot of things, but definitely breaks up congestion everywhere. And when I'm doing that, I'm massaging the belly. So I'm taking every one of these little pockets and turning it inside out into the water with my hand. I'm pulling the water in and I'm pushing it out, and I'm really stimulating that colon as much as people can handle. And some people can't handle too much. Some people are like, all right, I'm going to do that. You know, or I'm working over here, and they're like, no, it's over here. Great. Come, you know, like I really invite people to slap my hands away and do it themselves. I invite people to really get into colon consciousness. Okay. One of the first things I tell people is when you're sitting on the toilet and you're not going, but you know, close your eyes, put your eyes down into your fingertips, and start feeling it. Where is it? Where is it? Everyone's got different pockets somewhere, unique as faces. Okay, so nobody's colon in here looks like anybody else's. So just like a face is a face, a colon is a colon, but yeah, a colon could be 4 feet long, 6 feet long. I've taken care of one woman with a 10-foot colon. You think she had some issues? Oh my gosh, she had been constipated her entire life, and they finally they found this out on colonoscopy and with x-ray. And so she presented regularly. She used to have colonics every 3 weeks, and then she managed with a diet and enemas in between until she was about 87. So I took care of her for a long time before she could make it out her own door. And then I used to go visit her at home with enemas and do home enemas because it was sure better than nothing. And since her body was trained to have an enema after a bowel movement, I'd just go over and have breakfast with her and wait for her to go, and then we'd do it. So timing really is everything. And really, there's hope for everybody. She lived into her almost 90, which wouldn't normally happen with a person with a 10-foot bowel if they didn't discover how to get rid of the toxic load. There's this whole map of the body is not just in the hands, it's in the feet, it's in the tongue, it's in the face, you know, liver, lungs, kidneys, it's every terminal organ in the body is this magnificent puzzle if we only understood that it's all connected and it's trying to tell us something or giving us clues to how to be well, how to remain well.
Jillian, is there like something we can learn to do to help ourselves?
Yeah, if you look at the map, you can see where the colon and small intestine is. Usually, if you're feeling constipated or you have bowel issues, grab in between your thumb and your first finger and massage. Is that a little sore in there? Your thumb and your first finger, that big meaty pad in there. If you squeeze that and that's like tender, or you look at it and it looks like darker or bruised or different, yeah, that's your colon, and you can work it. You know, it makes a difference. On your feet, anyone have those rollers with the little rings in them? I meant to bring it, but you can sit at your desk and roll them back and forth on your feet, and it hits all those. It feels good. On your feet, your colon is at the top. The transverse colon is right at the top of your heel pads. Okay, and it curls around on one side down to the bottom of your heel for descending colon, and on your other foot down to the bottom of the heel for the ascending colon.
Could you kind of demonstrate what you mean by the top of the heel pad? You mean like?
Yeah, I gave you guys.
Here?
Did I give you feet? Do you have feet out there? Turn over the
We don't
chart.
have any feet.
No feet.
No
Just
feet.
hands.
Okay, I must have the feet. Where are the feet? Drat. I'll find them as soon as. Okay, they are. The feet. What I mean is the top of the heel pad is here. Okay, and these look like they're backwards, but right and left. And
So would you
can see-
actually massage this as you're sitting in the toilet for
Yes.
that 5
Did I
minute
ever
trial?
grab your foot while you were on the table and start
Probably did. I don't
pressing
remember.
the top of your pad?
That's interesting. And it
You
doesn't
can-
matter which foot or which hand?
Well, it doesn't matter which foot or which hand, but unless you see where ascending is different than where descending is. Transverse is right along the middle of the pad for both feet. That's this part, okay? And then on the left foot, you have descending colon, just like the descending colon's on the left side of your body. And on the right foot, ascending colon coming up from the ileocecal across. That is.
So you actually work both feet then?
Oh, yeah. And, or, depending where you get stuck. People have different pockets, different places. But everybody's got
Can you
pockets.
tell by
I
touching
don't
your
have
feet?
diverticulitis.
Yeah, oh yeah, diverticulitis. Let's talk about that for a minute, okay? Because, could I just say that this is the Barbie and Ken colon? Nobody looks like this. I don't care if you look like Barbie on the outside, your colon still doesn't look like this. And what happens is, it's only, these two corners are only held up by a couple of flimsy little ligaments, for one thing. And even though, okay, so they've cut away the mesenteric apron of this thing, just to show us what's underneath. That apron doesn't hold anything in place, really. And so what happens to all of us is, these two corners are way up under your first two little riblets, okay? And they're bent back on themselves. And so it's kind of looks like a design flaw because it's really hard for things to get up and around this corner when the transverse is sagging like this below, and most of us. Okay? So when you get on the john and start figuring out with your eyes closed where your transverse really is, the top of it's just above your belly button, just around your belly button. You can feel it. Okay? So here's belly button, just above colon, top of it. And then the bottom of the transverse is usually bowed way down here. And it's like a hammock full of garbage. Okay? And that's pretty routine. That's why an enema following a bowel movement is so fabulous. It just goes, okay, and allows everything else to move along. So a couple of other things I can tell you about moving things along is, on the appendix side of the colon, the ascending colon, where stuff dumps in after digestion is done. Colon doesn't really digest, it just absorbs water and some minerals and salts, but digestion is done in the small intestine. And whatever you didn't get in your digestion is compost. It's going to be dumped in here and start working its way around. Now when it gets dumped in here, if you're hydrated enough, if you're drinking good amounts of water and fluids and soups and teas and so on, then it's going to be pretty liquid on this side of the colon. And as it moves along, you know, water sloshes back and forth all the time on this side of the colon. That's how it drinks. And as it moves along, it gets drier and drier and drier because the colon's drinking water out of it, whether you go or not. Just because it's dry doesn't mean the colon's going to stop drinking water out of it. And so it gets so dry, it becomes what we call fecal stones. They're so hard, and they're deposited in little pockets off the pockets. That's a diverticula, a little pocket off the pocket. It's sort of like think of a girdle. It's just elastic, right? And when it gets overstretched, it kind of gives. Okay, so colon with little pockets off its pockets is not going to ever come back to its original elasticity. But those pockets can be cleared.
And one of the things with us EDS, I mean, there's different types.
Speak
but
louder.
One of the things with us EDS people is that my organs, my bladder and my colon stretches so much, like to the point where I've had people ask, "Are you like 3 months pregnant?" And I'm like, "No."
Yeah,
It's
right.
just, and so the super elasticity of our skin also goes into
Yes.
my organs too.
Yes, yes.
So-
And I think this is how
That's why it's
yeah.
constipated, because it can't,
Yeah.
it's not going to contract and push everything out
And then the
either.
dysautonomia kind of works because you said it's regulated by the autonomic system.
Yes.
If that signal with us doesn't go there, then it's just kind of sit there because there's no signal working properly.
There's something else going on in there too, okay? Let's just add a little drama to the drama. And it's called fermentation, okay?
Yeah.
So when stuff gets stuck in there long enough, it starts growing other stuff. Okay, we got like 300 trillion cells in this body, okay? And they're always producing waste, and they're always using they're oxidizing everything that you put in there. And if it doesn't clear, it starts to grow other bacteria. So the bacteria that's in your gut that makes up poo is basically driving your health, okay? So I believe that you can still bowel train even if it's really loose and elastic and saggy, okay? Because it's not the only part of your autonomic nervous system. It has independent reflex arcs from the spinal nerves, but other parts can compensate too. So I think there's hope. Did you do better after colonics than before? I think part of it is
never
just-
desperate like you. I was, 2-3 weeks
Yeah.
having no luck. and
Yeah, she was like she's going to explode.
Yeah, and felt horrible and felt pregnant, everything you're saying. And I think I came for 2 or 3, okay. And
Within 10 days or so, or 2
yeah, and
weeks.
I did pretty well for quite a long time. I'm on a bad time with my body right now, so I'm kind of thinking in the back of my mind, maybe it's time to.
So, and as timing goes, it's like we said before, it's very individual, but could we please at least do it with spring and fall, like every time you change the batteries, and your smoke alarms,
Yeah.
like every time you get your dental hygiene, which
So
should be
daylight
every 6
savings, we
months.
should add colonics in
Oh,
Baptist
yeah.
to our list, okay?
Yeah. Especially in the fall, especially going into the dark.
Why is that?
Because it's a
Changes so
terrible, terrible autonomic stressor to lose light, to lose heat, to go from green leafies and
Losing heat
beautiful
is a
fresh
really
fruits
huge problem.
and go towards root vegetables and comfort foods, gravy foods have, and just, it's really, really hard. Cold stress and everything about the fall. It just makes us all go,
My daughter's EDS hits are full-fledged once fall comes.
right.
Totally. She'll
Right,
be
that-
fine in the
that's not
summer, and
surprising
then
at all.
fall.
And
Trying to
not
figure
just,
that out. Is it
not
the
just
barometric
EDS, it's
pressure?
also any chronic degenerative stuff. And actually, it also triggers acute stuff too, because here comes flu season.
Yeah,
That's not a coincidence that it doesn't really peak in the summer.
it's so weird though, like it just fall, boom, she's just like wiped out.
Yeah, energy. A lot of energy gets sucked up by a constipated bowel. And it's dark. It's depressing, it's irritable. The reason I gave you that thing about unresolved feelings in the target organs is to show you the kind of feelings that gets carried in that bacteria, okay? It seems to me obvious after doing this for, now it's close on 16 years, that the consciousness of organisms in your body can take over your consciousness. Anyone with a sugar addiction knows this, okay? After a while, you get into the cycle long enough, that yeast is speaking. That's not your consciousness. You feel like you're gonna die the third day off sugar, okay?
And Jillian, for us with
few
EDS,
hours.
sugar is such a culprit for candida. We are so much more prone to candida with just a little bit of extra sugar in our body than the normal person.
Right, I
That's
know.
a
And
serious
poor
problem.
yeast gets such a bad rap because it's
inflammatory, too.
actually, it's a big cell and it's a sticky cell, and it is part of the body's way. As it overgrows and overgrows, it actually acts like a magnet and a sponge to garbage, and it does. A lot of garbage gets eliminated with yeast. But when there's yeast overgrowth, there's generally some underlying stuff going on. When it's a chronic situation and yeast is really thriving, it's because the pH of the whole body is off. You know, and in acidic environment, the wrong kind of bacteria are growing, the kind that sort of decompensate your health, not the ones that build it up.
This is a question for myself and anyone else. I crave like pickles, vinegar, mustard, salt, like, and just the vinegar and like with every restaurant I'll go to, I'll be like, can I have some lemon and pickles with that? And I didn't know if that was like a digestive issue because they're like, is that a deficiency?
Well, I think a lot of vinegars and pickle, all of that stuff, it does have minerals. I would pick up some Bragg's organic cider vinegar and liquid aminos, and those will really help your sort of salty cravings. And yeah, vinegar does dissolve a lot of plaque out of your blood vessels, pretty much out of your joints, out of everything. And a very, very ancient tonic is vinegar and honey together mixed in water, raw honey. That's the minerals, a little touch, just enough so that you can drink vinegar, and a little vinegar. You don't like pour the whole bottle, just a splash, and that's a very, very nice way to hydrate. Another nice way, if you can handle it, is to put a little bit of aloe vera juice into your water. It's bitter, but it's very hydrating, and it makes the water wetter, so it can get into the cells more efficiently, and then clean out the cells. You know, the cells have better exchange of nutrient and waste. So, good question. And the thing about using just any old vinegar and pickles is, it's really good to read labels, because most of the things that are on the shelf that have been bottled by someone else than you are probably gonna have stuff like MSG in it. And that's gonna knock you off your game too, okay, because that's a depressant. Go ahead.
You probably already know this, but you're talking a lot about the autonomic system.
Thank you.
That's one of the
No, I
pages.
don't know anything. I know less every day. Are you kidding me? The more, the further I go, the less I know, I feel like. But that's just because there's so much to know. And I thank you so much for this. That's gonna be my side. Good, you've already got the sympathetic, parasympathetic thing going.
Well, that's what I was saying, like a lot of us already have issues with that, so would colonics help those issues?
It will help reduce stress in your life. This, I promise. Why? Because it reduces the bacterial toxic load in your gut that's a drag on you. It's like carrying ballast that you don't need to. Everybody's carrying somewhere between 2 and 10 pounds in here. That's just luggage, okay? And, you know, if you're on the good side of it, it's more like 2 pounds. But that doesn't mean you have to carry it, you know? And I can tell you right now, you don't know what you're carrying until you put it down. And then you're like, whoa. Your spine's a little straighter, you know. Oh, my back doesn't hurt. You know, I'm not making this up. So, I wanted to give you sort of a different view of the same thing. Did I give you this lady yet with all the different energy centers of the body and the organs and hormones that are, okay. The important thing about this, I hope I have enough of them somewhere, is to notice that there are 6 major energy centers in the body, and these are rooted in hormonal and glandular systems, but they resonate throughout your whole energy field, outside your body and everything. Okay, so the one over the head is like the halo one you see in religious pictures, and that's the crown chakra. The one I'm really interested in here is the first and second one up, because I'm working in these first 2 chakras. And my feeling is, if we can clear the first chakra, it's sort of like tumblers in a lock. By the end of the hour, you're like, yeah, whatever.
Is that the yellow one, the chakra, the yellow?
It goes red, orange, yellow.
Yeah.
Yellow's the third one up, and that's the willful liver place. Okay, that's the place of anger, sadness, rage, unresolved
My
stuff.
daughter has a psychic friend, and he says she has yellow over her head. I know it sounds weird, but he's like, you have yellow.
Oh, a lot of
And she
us-
has
a lot of us in
huge
the West.
digestive issues because she's EDS. So I was like, oh, that's weird.
A lot of us have yellow too. I mean, we're not,
Because your emotions, you mean?
because of resisting emotions.
Alright,
It's a
okay.
willful place.
Yeah.
You know,
It's
solar
just
plexus is
interesting.
like taking a stand and like really digging in on it, you know?
Yeah.
And a lot of teenagers, a shit teen, will have a more yellow because they're into going, no,
Oh, me.
I don't think so.
She's 17, yeah.
I think I will have ice cream. As soon as you do. So that's part of it.
Yeah.
And it's really good to think of things in different than just physical ways.
Yeah, it
Because if you
is.
think of it in physical ways, it's really crippling. If you think of it as stuck energy, all you gotta do is move it.
Right.
And it's a really good time to examine your deeply held beliefs about energy in your body, okay? I believe deeply that this instrument was designed to last at least a couple of 100 years. There are documented cases where people have lived way over 100. Mostly in indigenous cultures, by the way, where they aren't eating refined foods.
Jillian, we don't want to go to 100 with this condition though.
Yeah.
Okay? We're not looking for that, are we? I think we'll take the shorter one.
I really feel like that's why people have the life expectancy that they have, because we're told, okay, now it's up from 77, it's like around 83, or wherever it is, you know, and that's what people are doing. Okay, well, I've got to 83, let me pace myself. When I had a brush with really near-death illness in 2010, part of the way I dealt with it was to do a lot of ceremony and conscious mindful ritual about offering myself up in 55 more years of service. And I think it's one of the reasons I'm here, because I'm pacing myself. I gotta make it to 110 now. And it's working for me. You know, I never had anything as daunting as you folks have to deal with 24/7. But I have knocked back melanoma and Lyme disease 3 times, and babesiosis 3 times, and Bartonella twice.
Oh, wow.
So a lot of people with that level of immune system damage aren't doing very well. And there are ways and ways, and you have to keep taking other things, because these little critters morph into other stuff and hide. And so what happens, I can't even imagine what happens when one of you guys gets a tick bite. You know, it's probably 10 times more serious than when it happened to me. But my feeling is that everything is manageable, and there's hope for every person, because there's always hope in the bowel. You know, it's a very forgiving place. And as soon as you clear it, and it gets all the attention, it wants to be the center of the universe. I mean, really, think about Japanese medicine. They call this area of the body the hara, and everything in Japanese medicine is diagnosed from the hara. So if you're feeling horrible, go there and clear it, you know, and see if your feelings change. Physical feelings, mental feelings, spiritual, all that stuff. It's very, very emotional, this place. And it's emotional because it's the age of a 2-year-old. Right? Yeah, it wants to be the center of attention, it wants to be the center of the universe, and if it doesn't get its way, it pitches a fit. Just like a 2-year-old. And when it gets lots of attention and cuddling and massage, clearance of castor oil packs, it calms down. And it's very responsive. Go ahead.
I tried massaging, and with EDS, that became a problem with my hands and my arms. Is there another solution for people like us? 'Cause I
You
know-
tried what I told you, but I had given you something to use that wasn't good for you. Remember, I gave you some St. John's wort.
Oh,
That might have been why the massage wasn't.
no, I mean physically. I can't, that kind of,
That's not
massaging
gonna work.
thing doesn't work with my arms.
Do you try myofascial release?
I have that
and all
5 days a
that?
week.
Okay, and
All
you
that,
can,
yeah,
okay,
but I
so
just wondered
I also want to say that, that's a really good question, because my style is a little more, like, just go for it.
Oh, it's fine when you do it to me. If
But you
I'm
can't.
at home and I'm.
But you don't need to do it as hard. All you need to do is, like, find the transverse spots, transverse, and just put your fingers there and, like, wiggle. You can do it lightly.
That's good enough? Okay.
Aye.
Okay.
How about
It's a
one
lot of
of
tension.
the rollers for your feet? Did you
Mhm.
use that on your stomach?
Oh, yeah, or a vibrator massage
That would probably also put our hands
from the vibrator.
vibrate the hands, but I was thinking, like, I know
The
you
roller,
talk
you
about rolling
can-
that you roll your feet
you
on.
can.
I know they make handheld ones.
Yes, you can. It's anything you can find that works for you. You'll think of some of this, I'll say this stuff and you're saying, well, that's not gonna work for me, but start thinking how you could make it work. Because I know you're nothing if not resourceful. By now you've pretty much figured out a whole new wheel that most people don't even know about. So I'm just trying to add in a piece here that for some of you might be really helpful. And even if you end up saying, gee, I don't want to do colonics. Come learn how to do enemas for yourself, and figure out some bowel training so that you can go regularly.
What does it cost? Because insurance won't cover, right? I mean, what does it cost for a visit or?
No, the only insurance that covers this kind of work is, the flex pay ones where you pay in and you get to do it on whatever you want.
So what roughly does
A session
go for?
costs $120, and then there are package deals, because nobody gets one colonic.
Right.
I mean, getting one colonic is great, and it does educate your colon and your mind hugely.
So you get a discount maybe?
Yeah, 3 for 300 or whatever, 2
Yeah.
for 200 or,
Yeah.
I just work with people. And then people who are on disability can, talk to me, I'm open, everybody needs the work.
And just to mention, because because I'm assuming you're probably gonna go for this. I actually never did the training of what you're saying after at home. I only did the colonics review, but I never did the home enemas, and I, for whatever reason, got my system on roll again with you. So,
Yeah.
but that wasn't
Sometimes
part,
it works,
and it wasn't
sometimes-
that I did, it wasn't assigned to me, so that's, I just want you to know I didn't.
Well,
That was
but-
part of.
But I think that, you know, once you're getting a colonic and I'm hitting all the reset buttons for the whole system, I'm counting on it
Yeah.
to reset. You know, it might not always reset the first time. But like I said, bowel training takes a while. Every habit in the nervous system takes, 2-3 weeks to set in. And so to finish the bowel training story, one morning the guy's gonna be sitting there on the john, the egg timer going, the bag up, gonna be about day 14 to 18, probably maybe 19. All of a sudden he's gonna surprise the hell out of himself and have bowel movement. He might not feel it, but he'll hear it. Wow. And he'll go, oh my God. And then the nurse comes in and goes, congratulations, you get an enema just for that. And then they clear the transfers. And that's the colon's lesson. Okay, the next morning it's gonna happen again. It's gonna go before the timer. It's gonna go before the timer, go before the timer, go before the timer, and she's gonna reward that with a bag of water. Okay? And that's how the bowel is retrained. It's pretty simple, and it's just water. So people go, oh yeah, but what if you rinse everything out? You're supposed to have good bacteria there. And my answer is, you sure are. So we flush some in afterwards, like 100 billion, 150 billion. If you got issues, even more than that. I mix the flora right into a little bit of drinking water, warm, and pop it right in through the enema tube when we're done. So that's your little.
So like probiotics?
Exactly, it's probiotics. And it's the bacteria, the friendly floors, the ones that make vitamin B, short chain fatty acids, little hydrogen peroxide, a lot of useful things that then you want to be the floor of your immune system, okay? Your guts, the 22 feet of small intestine and the 4 to 6 feet of large intestine carry about 80% of your immune system. You have, the lymph nodes that get sore when you have a sore throat, and sometimes you can feel them in your armpits or your groin when you're sick. You get 108 of them down your body, core and peripheral. And about 80 of them are in your guts, just patting cleanup for your poor colon and small intestine. Okay? So one of the things that happens during colonics is, in the beginning I'm doing the massage, oh, there's one, and they feel like little beans, little kidney beans or jelly beans, sometimes small like a pea. And by the end of the colonic, it's all flat. They just dump and take the opportunity to go whoosh. So that's a really useful thing to know, just lymphatic drainage. And castor oil packs really help also with lymphatic drainage. You can do a castor oil pack anywhere, by the way. On sore breasts, on a sore tooth, on sore kidneys, you can do it on your back. And I have here, did I give you the castor oil? Castor oil packs became really famous back from Edgar Casey days. Ever heard of him?
Yep.
He was like the sleeping prophet who was horrified I think he was some kind of Baptist, he had no idea what was going on really, but he kept going into trance. And so he would go into trance and lie down on the couch and start spewing all this stuff about remedies for people. And his wife would take notes. And I have to share this a little bit. I didn't bring enough. So, yeah, just pass them around a little. So anyways, he became very famous, and people came from all over the world to see him, to visit him for trance work. And he was dealing with people who had already been turned away, sent home to die. Okay, we can't do anything more for you, you're all done. So they would come crawling to Edgar Casey's house, and he'd go into trance and say, oh, well, you need this, you need that, you need that. And I think over 150 times he recommended castor oil packs sort of for everything. And lots of other things too. It's very, very interesting work. The Edgar Cayce Institute is still very active today and has its own colon therapy school and a lot of other stuff. It's a research foundation. Very, very useful for alternative healing stuff and worth looking up. What I'm using right now, and I switch these up sometimes, but I like this kind of, I like these probiotics. It's made by Ultimate Flora. One's 30 billion, and this has got 10 probiotic strains. And then there's one for adult 50 plus 25 billion strains. Slightly different, but all good. And could I mix them together? Sure I could. And will all of them make it through to the small intestine? No. A lot of them will just hang out in the colon. Many of them will make it into the small intestine. What keeps the water out doesn't keep these little guys out. They'll go through the ileocecal valve, and many of them will live happily for 3 days or so in the small intestine. And that's about how long these guys live, about 3 days. And then by the end of that time, all their little daughters and granddaughters and ancestors are making the new frontier safe for digestion.
How long does it take your body to naturally replace the good bacteria that it doesn't?
It really, really takes a long time. From being on antibiotics with chronic Lyme, I can tell you that it can take up to 6 months to replenish your probiotic, your proper complement of friendly flora.
I have a question, because you just mentioned that. I had C. diff about 2 years ago. So I never knew I had to replenish anything.
I'm so glad you asked this question. Because they're now treating C. diff in Providence, Rhode Island, really, really hard to treat cases. There's a gastroenterologist named Kelly. That's her last name. I wish I could remember her first name right now. Colleen Kelly. And she's using poop implants to correct C. diff. Persistent for years and years. People come in dying of the thing, and nobody can treat them. Nothing works. Guess what? Poop works. They use the poop of someone in the family who's, sharing some genes, genetic structures, and using the same refrigerator and eating at the same table. And they take that poo and they screen it for all kinds of diseases, and they make a slurry of it with a little saline, and they run it right into the bowel through an enema bag, or they can, if the big problems are in the small intestine, they can put it right down through an NG tube. And the thing is so amazing is that these symptoms of C. diff are like gone within 24 hours.
Did they
24
recently
hours.
have an article saying that they made them into capsules?
Yeah.
They're making them into capsules.
Yeah, just recently it was in the paper.
Well, there's a huge, there's a big political want this to be regulated as a drug. And a lot of people, shit. And a lot of people want it to be regulated as an organ or tissue. And that's completely different ways of regulation. And it's all hung up right now with political battles. And what's happening is people are reading the news and the New York Times and all this stuff and going, hey, where's my brother? Maybe I can, And this is freaking out all the doctors because people are trying this stuff on their own. And, it's a little bit sketchy, right? Still,
When you
it's
get
really
desperate.
still hard to believe that the Rodney Dangerfield of the entire system is producing this gold that is going to end up being like a major medicine for things like C. diff.
I had C. diff. I had a dog bite and a tick bite within about 2 months of each other.
Mhm.
So I had to go on antibiotics for both of them. And I got really sick. And probably I didn't need them at all. I don't know. It was prophylactically. But then I went to the doctor and I said, well, what's the solution? He said, I have to give you another antibiotic. I said, oh my God. What the hell is that going to do? I was really sick.
So I wouldn't say that you didn't need the antibiotic at all. I wouldn't say that.
No,
I
I
would say that
I
there are treatments that can
Yeah.
go with antibiotics that can really help reduce the chances that you might get a secondary infection like C. diff. But there's no guarantees, you know, I mean, we can use all kinds of herbs and things that will boost your immune system and your you know, increase your white blood count and do things to help you fight it. But I wouldn't discount the use of antibiotics for
Oh, no,
anything,
I would do the
you know,
same
right?
thing.
But certain antibiotics could cause C. diff. There's all these other specific ones that you wouldn't want to take.
Yeah, and I think you're probably just at high risk because of everything else. you know? But that was some of the most amazing research that's come out in the last year. And of course, my big fear is not how they're going to regulate it, but that once it's regulated, this is going to become prescription and really expensive and inaccessible to people. So I like, part of me wants to just probiotic stockade, you know. And I probably would, except that they have expiration dates. So where do you get probiotics?
Oh, no, go ahead.
You get them in food. You get them in raw food, uncooked food. Go ahead.
I was just wondering, what are, if any, of the bad things that can happen with colonics? Are there any?
Thinking.
Yeah.
Well, like ruptured.
Well, that was
issues with
something that I was
some, like,
concerned
EDS.
about.
Oh,
Yeah,
because of the
that's-
elasticity of your
Yeah.
colon.
Like
So,
tears, I mean, could we actually tear our colon or?
there's been a documented case of that in Texas, maybe over a decade ago, probably. The system that the person was using, the person that it happened to was very experienced, an older woman. She'd been getting colonics for years and years and years. The system that she was on, you get on and put in your own tube and do all by yourself. There's no colon therapist there.
Correct.
And she didn't feel that she had put it in wrong. She didn't feel it. Or she didn't feel the pressure. I don't know exactly what the circumstances were. And that's the only one that I know about. Okay, that's an open system. In other words, you're sitting, and there's an open or a closed system with colon therapy, right? So on an open system, picture like a plastic sort of gurney that has a semi-sitting and a big hole in the bottom of the table. So you're sitting over the hole, and you're leaning back, and you put in a tube that's the size of an enema tube, which is like the size of a pencil, with a blunted end. And you insert that, and you're not supposed to insert it very far. And then you just like let the water flow. On a closed system, it's a little different. On my system, it has pressure gauges that are that for the water filters to show when they need to be changed. On the machine, showing how much pressure is building up in the person, and when it builds up to the machine has this sensitivity, can tell when your colon starts to stretch beyond a certain point, it makes a noise and starts letting the water out. That's whether you know it, or I know it, or anybody knows it. So there are some built-in safeguards to that kind of system.
And also,
Can you control
when I'm on the table with Jillian, I'm allowed to say to her, okay, that's enough. If I start to feel like it's
And I
really
can
filling
feel
out.
it with my hands too.
Yeah.
I got my hand there. I
So
don't
you
leave the
have
room while
control
you're on the
too.
table.
Can you control the water pressure or the
Yes,
flow? Or is it
yes,
just, okay,
yes.
so you could lessen it to.
Yes.
Yeah.
I have a flow meter, so I can
Yeah.
run it in slower than an enema.
Right, so that might be something you'd consider.
Just to be perfectly honest with you in the room, I asked Dr. Choker when I was in trouble for 3 weeks, what do you think about the colonics? He's our pain doctor, and he said,
love him.
no, that's really scary, I wouldn't think of doing that. And I was desperate, and I trust Jillian, and I went ahead and did it, because I've had it in the past, and I knew it was the only thing that helped me. So I went back to it, and it was fine, and it changed my life.
Here's what I need you to do. If you're going to ask your caregiver whether or not you should get a colonic, I want your first question to be, have you ever experienced a colonic?
Right. He
Because
didn't really
if
know
they
that.
have not, they have no place
They
speaking
probably
to an
don't.
authority
Yeah.
about something they're ignorant about, okay? And that's true of everything. Like I said, I don't know everything. I know less every day, but I know what I know. This is not dangerous. This actually is good for everything from acute to chronic to palliative. I have a lot of hospice folks.
They're just a regular guy. He
A lot of
swears
people
by
with
it.
MS,
He's
a lot of
healthy.
people
He
with
just loves it.
Lou Gehrig's, a lot of people with diabetes, a lot of people with chronic degenerative things that get so much more mileage just by clearing the toxic load. So, so I understand that people are scared, you know, especially when they're told by their physicians, that's really dangerous and it's not part of mainstream medicine. And so there is a lot of ignorance about it still. But before I go, and I got 55 more years, it's gonna be mainstream. And I'm cleaning up the world one tushy at a time. Okay.
So is that why it's not covered by health insurance, because it's more considered alternative medicine?
I think that you have to understand that chiropractic was considered the alternative medicine, and they were like, we're only letting you in if you drop that.
Medicine, so it's not really alternative medicine as more.
This
like
is old.
older medicine.
Thank you for bringing that up. And could I just say that in the Essenes, Christians used to use enemas and fasting and, you know, all kinds of things to try and stimulate mystical visions. You know, that was all they're about, you know? And when they uncovered the Dead Sea Scrolls, they found, guess what? Instructions for enemas. Get thy hindquarters into the wind. Find the reed, the length of a man. Find a gourd and consult the angels of water.
Oh my gosh.
And hang the gourd, you know, so high from a tree, whatever. I mean, literal instructions in the Dead Sea Scrolls.
It's the same thing we're going
The
through.
Gnostics.
Prolotherapy is not,
So old.
prolotherapy, you know, they
It's
don't
not
know.
good.
And no, well, you're just in Boston to a search something, you've never heard of prolotherapy. And it's so effective with EDS and again, not covered. No, it's not, and that's been around since the time of the Romans. So it's same thing, it's a known helpful thing to do.
I wanted to, just to make that full loop back to Edgar Cayce, long after he died, and they busted the Rosetta Stone and figured out how, you know, what the Egyptian hieroglyphs were. It turned out that like some ridiculously high number, like 98% of his recommendations came from ancient Egypt. And they're like reading the Rosetta Stone going, wow, animals? Really? I mean, so really, there is nothing new under the sun. It's old, old, old. And elemental healing is huge in every indigenous culture. Sweating, you know, bathing, everything that is natural. You know, fire, water, earth, air, mud baths, you know, all of it. So, good to know. No, there's nothing new under the sun. This is just an updated machine that gives you sterile water and has someone sitting there with you doing massage and talking to you. The things that people release when they release the 10-gallon avalanche, you can't believe the stories. People say things that they've never said to anyone else and they never will again. They're like, whoa, where'd that come from? I'm like, oh, there it goes, down the dustbin of history. No fear. I don't hold judgment on people's shit. I'm just like thrilled to get rid of it. And when you get the 10-gallon avalanche, won't you hear me sing? Moon River, wider than a mile. The whole thing, of course I got my own words, but you don't get to hear them until you come. So,
you know, it really is kind of fun because you lie on this table and you do visually see the process happening, and it's really wonderful if you haven't been able to go to the bathroom for a while.
To see it,
It's really coming out again.
yes, and it tends to be, even if you've cleared the whole lower bowel with an enema, usually first you'll just be on the machine rinsing for a while. Nothing really, it's just like water in, gas out, water in, gas out, water in, little air bubbles, water out. And just when you're starting to get bored, all of a sudden, these rocks start rolling by. They start popping out of the pouches where they've been sitting for Lord knows how long, collecting dust and getting harder and harder. And once you get rid of the rocks, then it's sort of like your hand can't squeeze a cantaloupe very hard, but it does better with an orange, even easier with an egg, and you know, something smaller than that could probably like squash it. So the more the rocks you get out of the pockets, the more the thing can flex and move. Even in compromised circumstances, you can still get enough water in there to surf. And that's what I'm going for. So when the water goes in the first time, so we've cleared the lower bowel, and so the tube goes in, tube goes into about here. And the water starts coming in, first rinse, second rinse, third rinse, fourth rinse, you know. And I'm doing slow fills, and the water's, 100 degrees or so. Sometimes cooler helps if, just switching the temperature back and forth helps wake Sleeping Beauty up, because when she gets used to a nice temperature, she might go back to sleep. So once the rocks are out, then things start to become more liquid, and eventually what goes through there, you can't see through it. It's truly a mud river. And then once that clears, there might be 2 or 3 of those, and then once that clears, you get this sort of deep orange, I want to call it bilge, but it's really bile. And bile is your liver's sort of detergent for digestion, okay? So here's the liver. Beautiful old liver is sitting here. I don't know, there's like 3 or 4 pounds of it. And it's sitting here around this corner here. It's under your ribs. And the gallbladder is hanging off the back. The gallbladder is part of your liver. It's like, they treat it like it's separate. But really what's happening is all the bile ducts of the liver are draining into the gallbladder. And then when they're stored in there, they get 10 times stronger than they were in the liver. And then, every time you eat something, the gallbladder is supposed to put a little of that strong detergent into your small intestine to help digest and dissolve everything in the liver. So, liver function is really improved by adding water, by adding also. Go ahead.
If you don't have a gallbladder.
If you don't have a gallbladder anymore, she said, then your liver is still collecting and draining bile, and it's just going drip, drip, drip 24/7 into your small intestine. Which, good thing you got some detergent for digestion in there, but it's not as strong as it used to be. And so you're going to find having issues. In the old days, they used to say, well, if you've had your gallbladder out, you have to have a bland diet, you can't eat fried foods, you can't These days, most people with their gallbladder out just use digestive enzymes and, hydrochloric acid or, ox bile, or whatever they're using. They're usually adding things to make digestion more efficient.
If they don't, can it cause them to have more stomach pain and not? Or is that more the constipation?
I don't know what you mean by stomach pain. Are you talking up here or down here?
Yeah.
I'm not talking about you.
I get, I'll take like a couple bites of something. It depends on what it is, like meats I can't eat a lot of, and I'm full.
Right.
That's what she's talking about.
Right. Well, you're getting some feedback from your colon there. It's going, all right, we're backed up down here. Don't send anything else down. Okay, because it's going to have to upchuck. We can't handle it.
What's that?
Very, very often when you're constipated, you lose your appetite.
Yeah, but I'm hungry. That's the weird.
You're hungry. You think you're hungry. You're starving. You are starving. But go ahead and try and eat. Your body's not going to be able to process it. So it's okay. You might get more of an appetite if you can clear your bowels. And you might not. I don't know. There's so many things that could influence why you have a sore tummy. I'm just giving you a for instance. But if you have no gallbladder, then your digestion is definitely compromised, and it's a good idea to add some things into your equation to balance it. Because it's a way of thinking of things, If your overall health is just an equation, and you're supposed to be having, a certain amount of water every day, and a bunch of fruits and vegetables, and whatever else is in your diet. Like, you're on days when that doesn't happen. Just human, And when you have off days, dry days, malnutrition days, whatever, you gotta add something in on the other side of the equation, to get you that margin for error. And that's how I kind of think of colon therapy. And bowel hygiene is a fabulous margin for error, particularly for people with chronic illnesses. It's quite simple.
How long does an average appointment take?
I leave an hour and a half for sessions. And the first day it will probably take that long because we do a lot of education. Actually, on your first day, you've got all the education. So it might not take an hour and a half. It might take an hour and a half. Why? Because you're moving slower. Your systems are a little bit moving slower. And so it might take as long as it takes. But to leave an hour and a half means we're on colon time. It's plenty of time for that colon to get waterlogged and to move stuck energy. And after a while, frankly, it just, there's a feeling of building tension, like, oh, this feels maybe, I'm feeling really, I gotta go. And then, the release happens, and then after you get a few, if I get 2 or 3 clear ones in a row, that's my signal, I'm all done. You go sit down and use gravity. So people, after the rinse, then they go sit on the toilet again, put their feet up, and just apply gravity. It's not just a good idea, it's the law. And you really can surprise yourself after watching 10 pounds of garbage go by and then sit down and there's more, really? And so then you get up and walk around and make sure, do a little hula and kind of twist around and make sure that nothing else is going to shake down. And then you get back on the table and I put in the flora. And then the flora goes in like a little ½ ounce of water. And there are cases where that will trigger another avalanche. People go, okay, I'm not gonna be able to hold that, I gotta decide to drug. It's like, I'm just gonna cheer, if that happens. But more often than not, you've moved so much stuff by then that it just like sinks in. It goes, you don't feel it, it's like, forget about it. You might see it on your next bowel movement as a little white bit of mucus, or you might not see it at all. The longer you hang on to it, the more it has a tendency to form a little beigeish or whitish stool. And it only takes like 5 to 15 minutes to like regulate. It's gonna make its way all the way around. It's like sand. It's gonna swim right upstream and go, oh, my new home. And because at the last fill, when all the water's going by clear, I'm also seeing like little white feathers. That means we're down to the bare walls somewhere in there. And the mucus is being pushed out continuously by the colon. That's a normal thing. It wants a layer of mucus in between it and the rest of the galaxy that's going through you. It's its only protection, this one cell layer. And so that top layer pushes out a ton of mucus throughout the whole colon. And that when it's white and feathered, that's your new filter for drinking water. And that's what I want the probiotics to set up on. So that's why it's good to pop them into the